My name is Nicole Bruno, and this is task number 20, performing urinalysis. Here is my OCCI certification. So first I'm going to collect my free catch UA sample from my patient. So I've collected my free catch urine sample from my patient. I have placed it into this plain white top tube. There's about 3 milliliters in this tube, 2.5 to 3 milliliters. So first what you want to do, first thing I noticed, it did have kind of a strong odor. So you want to make sure you mark the physical characteristics of the urine. So here's my urine here. Does not appear cloudy. It does, however, appear a little concentrated. Maybe the patient is a little dehydrated, which we will find out through our further testing. So next what you want to do is obtain a specific gravity from our refractometer, which is here. So with our refractometer, you want to place 1 drop of urine onto the glass portion here. So I'm just going to open this up. I'm going to take my syringe and obtain 1 drop of urine. I'm going to place my drop on my refractometer. Like so. I'm going to close it, and then I'm going to look up in the light and read it. So it is the number all the way to the right, and I'm getting a specific gravity of 1020 m per deciliters. Just going to clean my refractometer here. Place it away. So most importantly, what you want to do is record in the patient's record. So first I'm just going to record the color, so it does appear concentrated, the odor, I would say moderate odor. It's not cloudy. My specific gravity, just going to mark here, was 1020 or 1.020 m per deciliter. Okay. I did not see any foam. Okay, so next what I'm going to do is I'm going to use my dipstick. So dipstick can be used to determine the chemical observations of the urine sample you're testing on. So this would be able to indicate the patient's pH in the urine, glucose, protein, bilirubin, ketones, and if there's any blood in the sample. So this is how you would read it. The chart is actually on the container. So what you do is you take out the stick. Here's my stick here. And I'm going to put 1 drop onto each colored line here. So I'm going to go back in my syringe, take out some of my sample, and now each has to be read at different times. So I'm going to start here. My glucose is read at 30 seconds, so I'm going to start from the bottom. And I have my timer over there. Okay. So first is my control. Okay, so glucose is read at 30 seconds it's negative. Bilirubin's negative. Ketones. Looks like there's trace amount of ketones, negative. Specific gravity is at 45 seconds. It's coming up exactly what I read on my refractometer, 1020. Appears to be trace amount of blood. pH is around 7. Okay. So here's my stick here. So I'm now going to record all of my findings. So, glucose was negative, bilirubin was negative, ketones negative, borderline negative in trace, so we'll go back to that. Specific gravity, 1020. There was a trace amount of occult blood. pH was 7, so neutral. Okay. So now I've recorded my findings. We can now move on to the next step. So our next step is going to be to centrifuge our urine sample for 10 minutes at about 1500 RPMs. So I have my sample here, and I have my balance tube here. So just going to balance it in my centrifuge. I'm going to close it, and I'm going to set it for 10 minutes, and once it's done, we will decant the supernate, and then we can look at it under a slide. So my sample has finished spinning for 10 minutes. So now what I'm going to do is decant the supernate. So I'm going to pour out the supernate into the sink so that I'm just left with my sediment. So I'm just left with my sediment. So next what I want to do, I'm just going to move the camera so that you can see a little better. So I'm now ready to make my slides. So for my first slide, I'm going to put 1 drop onto a clean microscope slide using my pipette. One drop. Okay. And now I'm going to put a cover slip to my slide, like so. So there's my first sediment slide. Now next, I'm going to change my pipette to a new one. And I'm going to add 1 drop of methylene blue into my sediment tube. I'm going to mix it up really well and then put that drop onto a new slide, onto a second slide, I should say. So I have my methylene blue here. So I took up some with my pipette. Going to add 1 drop. And I'm now going to mix it up really well in my tube. Okay. And now I'm going to add 1 drop onto a separate clean microscope tube. Or microscope slide, I'm sorry. 1 drop. Okay. I'm going to put another cover slip on this slide. So now I can begin to look at my sample under a microscope. So I am now ready to begin looking at my microscope slides under my microscope. So things that I am looking for when looking at this slide, this urine slide, are any casts, crystals, any cells, or anything abnormal. So casts could indicate renal disease. Some patients do not have casts in their urine. That necessarily does not mean that they do not have renal disease. So different types of casts have to do with how long they sit in the renal tubules. So crystals are very common in urine. There are many different kinds of crystals. So before I begin looking, I'm just going to show my brief little diagram here. So there are normal and abnormal crystals. So these are some normal ones: uric acid, calcium oxidate, hippuric, calcium phosphate, triple phosphate, calcium carbonate, ammonium blurate. So these are all what I would be looking for under the microscope. Here are some examples of some abnormal crystals. So these can cause a lot of problems in a patient: bilirubin, cholesterol, cysteine, leucine, sulfa, tyrosine. So again, these quote-unquote normal crystals can also cause problems in the patient. Some patients are asymptomatic, however, with them. So different diets can help aid or destroy these crystals. So I'm first going to begin looking under low power on my microscope. So I'm going to look at under 4x, and I'm going to see if I see anything. So I'm just going to briefly describe some of the common crystals found. So these are the struvite crystals. I just printed out a better picture. So they're very distinct looking. Causes of a patient having these crystals are an alkaline urine. Steroid therapy is also common, so if patients are on long-term courses of prednisone, for example, they can end up having struvite crystals in their urine. Again, necessarily not abnormal, could be considered normal depending on the patient. A UTI could also cause struvite crystals. These are most common in females, these type of crystals. Next we have the uric acid crystals. These can occur with high amounts of purine in the dog's diet. Also, liver shunts can cause uric acid crystals. These are the calcium phosphate crystals. These are also very distinct looking. These are very common as well in dogs. And then we have the calcium oxalate crystals. So these are the most common in dogs, in male dogs, I'm sorry. It can have something to do with nutritional supplements, so a lack of vitamin C or D in the diet can cause these crystals. So here are some pictures of casts. Again, they do vary. They are considered molds of the kidney tubules. So they form proteins or cells within these tubules, which then get passed into the urine. Depending on how long they stay inside the tubules depends on the outcome and what they look like. So the type of cast actually can represent how severe the disease is in the patient. So for example, waxy here is most severe, meaning that it stayed the longest inside the tubule. So then we have hyaline here, which is very mild, or the least severe. Kind of hard to see, I know. And then this is cellular to severe, coarsely granule. So these are casts. So there are various cells that can also be found in the urine. So white blood cells can be found. So white blood cells can indicate various things when found in the patient's urine. Depending on how much or how many there are, that can indicate cystitis or inflammation. Of course, bacteria can indicate an infection. And then we have red blood cells. These are very enlarged, but they are just circular, non-nucleated cells. So I've been looking under my microscope here on 4x power of my stain slide. I do see a good amount of red blood cells, which was actually indicated on my dipstick sample. I do not see any crystals or any casts. Again, if I did, I would notify my preceptor and have him come take a look for me just to verify. Again, just see some debris and mostly red blood cells. So once I'm done, I turn off my microscope slide. Just going to get rid of my sample, and that is how you would perform a urinalysis.